I welcome Dr. Sulagna Chakrabarti. She is a consultant child and adolescent psychiatrist in South London and Maudsley NHS Foundation Trust, London. She will be covering COVID-19 pandemic and domestic violence issues. I would now request her to kindly Deepa.
Thank you very much, Himanshi, for the introduction, and good evening to all of you. I'm a consultant pediatric liaison psychiatrist at London, working for South London and Maudsley. A big part of my job and my work base is at King's College Hospital, where I am responsible for seeing the children and young people who present to the accident and emergency department, as well as any emergencies in the hospital. In this way, I get to see a lot of the issues that we are going to discuss today over the next 2 hours. I'll try to pull up my presentation. Please give a nod when you can see it. Can you see it?
Yes. No.
Sorry, can you see it?
No, I cannot see. I'm not seeing. Not.
You cannot
Hello?
see.
Yes.
Hello.
Hello.
It is not visible, ma'am.
Yes,
Okay.
yes. Not.
Okay.
और बाई चांस मोबाइल में मैसेज आएगा तो
Not sure what's happening. Shall I send my presentation? I'm mindful of the time. Shall I send it to Himanshi?
Ma'am, you can do it. You can share it to me.
So I'm emailing you the presentation.
Okay, ma'am.
Okay, thank you. I've emailed you. Please let me know.
Dr. Sulagna, you can present without slides also. You can present.
Okay, so let me get started. So as Dr. Pradeep mentioned, that the topic is international webinar on COVID-19 pandemic and domestic violence, issues, challenges, and management. I'll be covering the talk on the following objectives in terms of our role, the consequences of what this means to us in fulfilling our role. I'll be touching a little bit on statistics, the various pathways, the risk factors, and the complex etiology behind this complex scenario. If time permits, I'll discuss a few case scenarios, and thereafter the barriers and mental health issues which we are all mindful of. Sorry, I'm just mindful of the fact that without the slides, there will be some limitations. Have you received the slides, Himanshi?
Ma'am, I have received it. Give me a second, please. I'm just presenting it.
Yeah. So I'll move on from there. I'll allow Himanshi to bring up the slides. And so moving on. So what has this meant? So WHO declared COVID-19 as a pandemic on 11th of March, 2020. So, 11th of March onwards, means before that, there were various parts of the world which were under lockdown. But as the pandemic word came in the surface, various parts of the world, they came under complete lockdown. So what is the meaning of, what lockdown means to us? It means social distancing. So advising the whole population to self-isolate at home if they or their family have symptoms. There has been bans on social gatherings, stopping flights and public transport, closure of non-essential workplaces, which we are all following. We are just leaving home only when there is an absolute need and you need food. Under those circumstances, you are leaving home. Other than that, pretty much the entire time you're housebound. Closure of schools, colleges, and various universities. There is prohibition of all non-essential population movement and limiting contact for special populations, for example, care homes and prisons. As a consequence of being confined to home, we've seen that there are large effects on health and there are health inequalities. These effects, they have numerous mechanisms, including economic, social, health-related behaviors, and disruption to services and education. There is a huge amount of economic pressure on the society, and we don't know in how many years' time we will be able to kind of come over it, if at all. But, this pressure is more so poignant and more so meaningful for the vulnerable population, which is, people who are, socioeconomically deprived. I'm sorry, Himanshi, if I can ask for a favor.
Yes, ma'am.
Would you be able to move forward the slides for me?
Objectives?
Yes, we've covered that. Move on. Yes, move on. Yes, the next one. Yes, so we'll stop here. Thank you so much. Thank you.
You're welcome.
Yeah. So what this has meant is that, the world is, this topic, this family violence, it's got various names to it. We call it family violence, we call it domestic violence, intimate partner violence, and violence against women and children. So, various parts of the world, they call it in various names, but it all means the same. Okay, it happens within a domestic space, within the confines of the household, when one individual holds power over the other. So it's a power discrepancy between someone over the other, and usually, that's the kind of the dictum or the broad frame that male have, worldwide. This applies worldwide. It's male's superior dominancy over female. And that's how the statistics goes ahead. So it refers to threatening or other violent behaviors within families, and that may be physical, sexual, psychological, deprivation and neglect, economic. It may be at, simmering level, name calling, hitting, various things are included in this. And in this picture, it also includes the elderly abuse and child abuse. Let's not forget that, because they are part of the family, and they are the vulnerable population that we are looking after. Next slide, please, Himanshi. So up until last year, the global statistics was that 1 in 3 women are affected. But going by literature, the number has risen, and it is now 1 in 4. 1 in 4 is the rough statistics, and 1 in 10 men also. So men are not. It's not that men are not included. So it's 1 in 10 men with some form of IPV. The median age of the victims is about 30 years. Again, this is from a paper that was done by a radiological service which looked after, which did radiography for, some kind of violence, and they found the mean age was 30 years and 80% were women. Please move on, Himanshi. Thank you. Now, if you hit Google search, and the search engine tells you that in the last 6 months, there's been a high kind of search of, there's a spike in searches for domestic abuse report on the day that the lockdown was announced. So whichever country you belong to, the day the lockdown was announced, and more so, and this I think is very much applicable to the UK statistics, which is 20th of March, lockdown was announced, that day the Google search of domestic abuse was sky high. It was also reported that on Monday, the 6th of April, the calls to the helpline soared by 120%. So we can see from here how critical this topic is that we are talking about today. Please move on, Himanshi. Okay, a little bit about the world statistics of how it stands as of now. So France, there has been a 30% increase since the lockdown. Talk about Argentina, South America, 25% increase. Cyprus, again, in Europe, about 30%, Singapore, 33%, and no other countries left. Move on, Himanshi, please. Thank you. So the world by numbers, China, in February 2020, China, there was a 3-fold rise. Brazil, can you imagine, it was about 40-50% rise in domestic violence cases. Australia also sits in with these similar statistics, and so does UK and USA, around the numbers of 25 to 30%. Next slide, Himanshi. The same applies to Italy, Israel, but I will mention, I've written in this slide a little bit in bold, because in India, situation is really grave. As per the statistics released by the National Commission of Women, NCW, in India, early April 2020, there has been 100% increase in complaints related to violence against women after the nationwide lockdown was imposed. So, Dr. Pradeep and Himanshi and Shatabdi and all of you, the majority of this platform, you will be dealing with, really meaningful cases you can make a difference in by your work. So the population, the numbers are huge in that part of the world. Next slide, Himanshi, please. I'm talking about the pathways. So what is actually, happening in this lockdown state that is leading to what we are seeing today? Of course, we have economic insecurity and poverty-related stress, and like crisis, any crisis situation, generates this stress. We've seen it in the past. We've seen it in previous, pandemics or any wars, we've seen economic insecurity, and any stressful condition generates to increased interpersonal violence, and pandemics are no exception. Quarantine, that is, social distancing. Social distancing is, again, a very key point where, pandemics and health and emergencies have seen that, domestic violence cases are on the rise.
Sorry to interrupt. Sulagna, sorry to interrupt. Himanshi, kindly you share the full screen, please. PPT is not visible.
Sorry?
PowerPoint is not visible. Himanshi, kindly share the full screen.
Yeah, Himanshi, would you kindly share the full screen?
I have done it, ma'am. Please check.
Okay. Thank you.
Thank you.
Thank you. So disaster and number 3 point, disaster and conflict-related unrest and instability. Again, it's it comes with any disaster, be it a volcano eruption, be it an earthquake, be it a landslide. But this pandemic, they are localized issues, but this pandemic is worldwide. So there's worldwide unrest and instability, and more so about the the future. We can't see it. Where does this take us to? We don't know. Everybody is in this limbo land and, swaying and being dictated by various policies which come up on a day-to-day basis, and being relying on that is how, extremely unsettling. Number 4, again, this is very important, is the exposure to exploitative relationships. So you are housebound and your perpetrator is in front of you. And it's that kind of complex mechanism, 24/7, being exposed to that mechanism that affects, that leads on to the violence in the long run. Also, there is reduced health service availability and access to first responders, inability of women to escape their abusive partners. Before they would be able to leave the home and go to a friend's place or, their mother, they visit their family. But at the moment, there's nowhere to escape. Where would she escape? She's confined to the 4 walls, 1-bedroom, 2-bedroom flat, or a hut, or whatever the living situation is with the abusive partner, with 4 children to feed. Before they went out, but here in this situation there is no escape. Okay. Number 7 is virus-specific sources of virus. Make adjustments. Next slide, please, Himanshi.
Yes,
Risk factors. There are multiple risk factors in this game, and they all interact with each other in an extremely complex manner. Talking about the first important, the societal risk factors, as you all know, and we've touched on a little bit, there is rapid social change, gender inequalities, there is high poverty level. Even the most affluent will try to struggle to find food in their home. People are stockpiling for 6 months ahead of them, but then ants grow and various flies creep in, so you're unable to use that food which you've stockpiled. So poverty is a kind of a vicious cycle, even for the richest of the rich. Weak economic safety nets, poor rule of the law. We don't know. There is no set law in stone, which is, even the law doesn't know which direction it's taking. Cultural norms, of course, there are various cultures worldwide, where, this is acceptable. And people give a shrug to, oh, so what if the woman got a slap from her husband? That's quite normal, isn't it? So this is the kind of the cultural norms that is embedded in our society, and that takes a peak when social distancing is comes into play. We talk about the community. There is poverty again. There may be crime levels, unemployment, and again, situational factors. Relationship factors are most important in the background of where there was already a discord. Now, I'm not here to say that pandemic breeds violent men. I'm not saying that. Pandemic doesn't breed violent men. It is about the violence that was pre-existing that takes a different shape, or there was no violence because they were partying for their daytime job, but under this situation they are coming to know each other more, where this discord magnifies. On this note, I'd like to say that I've come across families in this context where families have come close together during the pandemic, where before they were struggling to find time for each other. The pandemic doesn't necessarily mean that this is the outcome. There, love and good harmonious relationship does come out of this quarantine. But again, we are talking about the most vulnerable population in today's talk. Individual factors are again very important, child maltreatment, alcohol abuse, and so on and so forth. Next slide, please. We're talking about pregnant women. Pregnant women, again, a vulnerable population, and it's quoted by Refuge in a very recent paper, which says that domestic abuse risk escalates in pregnancy. So this is, again, a very, very pertinent area. Moving on, Himanshi, next slide, please. So this is a chart which weaves in together the various complex factors which come into play, be it because of COVID-19 infection, be it social isolation, be it restrictions that are imposed and transport and closure of educational facilities. So, various factors which I've already talked about, be it, you are unwell, which leads to fear and anxiety and staying at home. All these factors, they react with each other in a very complex manner and gives rise to the violence that we are seeing during this pandemic. Next slide, please. So I move on now to, describe a case where, I've been involved in looking after for this 13-year-old who presented to the hospital. He was airlifted because it was a suicidal case, a hanging case, where he was found by his parents, near dead, with a Glasgow coma scale of about 3 or 4. So he was airlifted into the hospital, where I saw him. He again, seeing the assessment comes after they've had that journey from being in the intensive care unit, receiving robust medical support, whereby he was brought back to life, and thereafter the story generates, the story evolves. He was not known to services. People did not know him having any mental health issues at all. And it was a very difficult case. I'm going to talk about the barriers later on, which a typical case which shows us the various barriers we as professionals face in our attempt to dig out what's happening in this family. Because families, as it is, the barriers are, we have our own barriers, professional barriers. Should I or should I not be asking about it is the biggest thing. And how far do I probe? And there are barriers from the family as well. So it was a hanging case, and then the parents were very affluent, very, very high functioning parents. Mom is a teacher, dad is a barrister. there is a younger sibling who has some form of congenital deformities, where the family is sort of focused on, family's attention is slightly more on the younger one. And this one, the 13-year-old, who is the older one, and my team got involved in, it was like, lifelong, looking up to him, that he's the role model. He has to fulfill his parents' dreams. He's the torchbearer of the family. Those expectations are sky high. And as soon as those expectations rise, and there is a kind of a, tip of the iceberg phenomena, like, the child performs, but if you think that it's not possible, then it comes in the form of low-grade simmering kind of dialogues that we can't trust you. You are not good enough. You're not doing, as good as you should be doing. So that kind of ongoing violence, emotional abuse was, the child could remember that all his life, and comparison and everything. It did not amount to, hitting or, thrashing him or punching him, but the low-grade abuse was so strong that in this lockdown period, when confined to the four walls, it felt to him, what's the point in living? I'm giving in my everything, and there's it doesn't carry a meaning for my family, and that led to what he did. So the story went on, but I'm going to stop here in terms of how the formulation of the cases, building up layer after layer. It took us really weeks, and being able to unfold the story. And then once you've got the child on your side, the parents start to kind of unfold. It's hard for them. It's a very difficult, sensitive issue where there are no, surface, bruise on the surface, but the bruise is internal. Next slide, please. So I talked about the barriers of the service user. And this again is, should I not be sharing it with the, with the professional? So these are the various barriers. There are cultural barriers. There are gender-driven barriers. Barriers exist, for example, if I said, what will happen to me later on? Would my perpetrator abuse me even more? Would I have food to eat? Would I be thrown out of house? Or will the abuse be even more? So it's the various questions that come in thereafter. Next slide, Himanshi, please. I'm nearly there. Thank you so much, Himanshi, for this ongoing support. So this slide talks about our barriers, the barriers that we have within our minds. For example, personal discomfort with the topic. One may feel, shall I ask or not? Shall I probe along those lines? It's the personal discomfort, lack of confidence in approaching the subject. It's too complex an issue to kind of unfold. And people may even say, this is not my zone, this is not my headache, it's a family's headache. It's not my headache to probe into these issues, it's their headache, it's their family, it's them to decide how they want to live their lives. So it's the professional barriers that are there. From that, I move on to my last slide. So all the things that I've discussed here, leads on to significant mental health issues. There is high morbidity in the society. It leads to post-traumatic stress disorders, which again is an immunocompromised state to move on. It leads to depression, anxiety disorders, medically unexplained symptoms, MUS, medically unexplained symptoms. We see this quite a lot in working in a general hospital, where children and young people, adults, they're present with somatization issues like loss of a limb function or stomachache, and then as you try to probe and, the assessment goes on for days, then you understand that the woman, the lady or the child is living in an extremely violent in a home where there is high noise level, throwing, hitting, slapping, critical comments, 24/7. And then last but not the least is relapse of existing illness. The patient may be known to services, but under lockdown, the stress level is so high that they are not compliant with their medications or not compliant with their therapy, and the ongoing noise level and stressors, it leads to an unending, ever not ending kind of a vicious cycle of illness, which is very, very difficult to come out of. So on that note, and I end my talk. I will await your questions towards the end. I think that's what Dr. Pradeep told me. But thank you very much for listening to me, and thanks Satan Himanshi for helping me out with the slides.
Thank you so much, ma'am, for sharing with us your valuable knowledge. Thank you so much, ma'am.
Welcome.
Now, I would like to welcome Dr. Deepa Thomas. She is a registered clinical psychologist at Alberta Health Services, Canada. She will be covering challenges in COVID-19 pandemic and domestic violence.
Greetings to all. Let me first of all thank the All India Association of Medical Social Work, who's given me this opportunity to be a presenter or this seminar, webinar. And I'm so glad to see a lot of faces. Dr. Pradeep, Dr. Sulagna, I'm so happy to be back on this platform, presenting once again as we did back in our training years. And I'm also glad to be a co-presenter along with Dr. Muneeba, Shakil, and Dr. Mohammed. As Himanshi had introduced myself, I work as a registered clinical psychologist with Alberta Health Services. My areas of practice, I work in the seniors mental health program and the brain injury program here in the Alberta Health. So my role here is to cover the challenges that is usually seen or that is generally seen in the upsurge of domestic violence. So I'm just going to start with my presentation. Okay, Himanshi, I see that you are here. You have already put it up for me. Thank you. Yes, so, I'm just going to cover probably a bit more in detail what Dr. Sulagna had already covered in the areas under barriers and challenges. What we see during this upsurge of domestic violence, there has been an increased risk of domestic violence that has been associated with the infection reducing measures of staying at home, lockdown, which has been undertaken by governments globally. So in this upsurge of the pandemic, we see another pandemic of domestic violence that we could refer to as the double pandemic. And this is a global public health priority. So this is not a new trend because increased abuse has been an observed pattern in many emergencies and crises, whether it be natural disasters, disease outbreaks, conflicts, or economic crisis. So The previous epidemics such as Ebola outbreak in West Africa, Zika virus outbreaks have led to regional environments where domestic violence have become more prevalent. Also with the recent Katrina disaster, there has been reports of domestic violence. So we see, as Dr. Sulagna had already mentioned, domestic violence is actually associated with physical and psychological morbidity, fatality, and mortality. So although the rates of cases of domestic violence that have initiated for the first time under the pandemic-induced stress is unclear, there is increased stresses due to pandemic that may aggravate domestic violence if violence is already an issue in a relationship. So while I was thinking about the challenges, I was thinking it in twofold. One is there has been already existing domestic violence in the family, and it is just that the pandemic lockdown and stay-at-home measures have increased it. So it just simply means if a person has been abusive in the past, he may have become more violent because of added stressors. So, you know, it may be unusual to see a person who is normally calm and non-violent to suddenly start violence in this lockdown measures. But the person may succumb to stresses if he has a predisposition to poor stress tolerance and poor coping strategies. So there has been increased concern of domestic violence. It's reported in many countries. That's why it's become a global health concern. US, UK, France, Spain, India, Italy, China, the country I'm in, Canada, reports of substantial increase in calls to intimate partner violence emergency support lines. So, you know, if I was to just present quickly the statistics, you would see regions in UK and France have seen increases of 20% and 30% respectively in police reports of intimate partner violence. In Alberta, the province that I reside in, crisis lines have seen 30 to 50% increases in calls. You know, it just seems that, you know, the pandemic set in, and then there was this upsurge of domestic violence that has been noted. In Ontario, in which our capital resides, the police departments reported 22% increase in domestic violence and sexual assault incidents. So the same social factors that put people more at risk for violence poses challenges in the management of domestic violence in this pandemic, the COVID-19 pandemic. So I'm just quickly going to go through those challenges. Social isolation and disconnection from social support systems, inability to escape abuse due to travel restrictions and quarantine measures, exposure to economic, financial, and psychological stressors, rise of mental health issues, poor or negative coping mechanisms such as substance misuse or alcohol misuse. Then I would also point out the decreased access to healthcare, social services, and other community supports. So going to the next slide, Himanshi, please. So when we talk about the strategy that was mandated to protect people from the pandemic and to curb the virus actually has perversely impacted the victims of domestic violence. So, so this has given rise to a double pandemic. It's a public health priority. So what actually COVID-19 has done is it has resulted in partners and families having more time together at home. Schools have closed, daycare centers, access to daycare centers for children are no longer available. The whole family is at home, living in small spaces. So this, and there are added stresses of uncertainty. One doesn't know when this pandemic is going to end. One doesn't know what's their future. So there is a added stressor of uncertainty. There's uncertainty about jobs, There are lots of jobs. I know so many people have been laid off during this pandemic, and it's something that has been so unexpected. I know the province we were in, we were just climbing out of recession, and there it is. The pandemic has struck again, where many people have to stay at home, work from home. Eventually, one fine morning, they've been told that they are terminated from their jobs. So this have added a lot of financial crisis and worries. So this proximity for long extended periods of time cause an increase in stress levels. So this confinement is leading to another spiraling crisis, that is domestic violence. So for many people, for us, home is our safety zone. It's a safe place. But for many people, home is not a safe place or a safe option anymore. And so unprecedented stress of the pandemic could breed unsafety in homes where violence may not have been an issue before. Like Dr. Sulagna had mentioned, this pandemic has actually brought families together. Very true, it has brought families together. Many families have been able to spend quality time with their children, spouses, but at the same time, for some people, it has been a pain where there is a spiraling in crisis or the unprecedented stresses. So what happens here is, with confinement and social isolation, victims of domestic violence attract their abusers. They're in an abusive situation where they find themselves facing more extreme violence and cannot escape people who should not be living together. So what happens here is, people who should not be living together are compelled and mandated to be under one roof because of the lockdown measures and stay-at-home measures. So what we have over here too, the number of people seeking help has increased significantly through the weeks since lockdown. So if you were to look per week, there's been a significant increase due to the stay-at-home orders imposed. So I was just looking at the statistics in US. It showed that Chicago calls to hotlines and police soared significantly in weeks. So the first week of March, when the lockdown had been imposed in US, there was 383 cases. End of April, the weekly number had risen to 549. So, the calls to police increased by 12% during a period from the start of the year to mid-April compared to the period in 2019. So it means domestic violence was there, but there's been an upsurge again because of the pandemic and stay-at-home measures. So again, another thing that was noticed was, instead of calls, text messages to hotlines increased, indicating that the victims have little physical distance from abuses, and texting is safer than calling. So again, another thing noted in some other cities was there was a drop in calls, implying that the victims are unable to call the police too. So in short, stress caused by social isolation, that is, you're isolated from your family, you're isolated from your friend network, you're isolated from your work group. This has aggravated tensions and increased the risk of domestic and sexual violence against women and children. Again, we are not, there's been more gender-specific violence that's been reported in this upsurge. So another challenge that we see in this pandemic related to domestic violence are the travel restrictions that's been imposed between cities, districts, states, and even countries. The restrictions that have been imposed to limit community spread of COVID-19 virus. So what happens here, the victims or the survivors are unable to get back to their homes or unable to get to a safety zone or a safety shelter. And other thing that's been noted again, is victims hesitate to seek refuge at their parental home or with their extended family or with or with friends because of a fear of exposing other people to virus. So this have been some of those challenges that has to do with confinement and social isolation. So, Himanshi, the next slide, please. So, another challenge is that we see in this upsurge of domestic violence is the fear around economic recession, job security, financial crisis. So this all put a lot of pressure on households, and this increases the likelihood of conflicts and violence. So among these survivors or victims, there is a fear of unemployment, monetary security, or lack of finances to help support oneself after escaping the abuser. So this forces the victim to stay with the abuser. I have had some clients that came to me to say that we are unable to make a decision to move out because we do not have enough funds. The pandemic was sudden. We never calculated that this would happen. We do not have enough resources to move out. So many of the victims are forced to stay with the abusers because of monetary security. So this is also a challenge, that we see when we talk about management of domestic violence. So the next slide, Himanshi. So to note here is that the challenge during COVID-19 not only lies in the increase of domestic violence, but there are concerns around rise of mental health issues. You will see that domestic violence is actually rooted in a need for power and control. So individuals who cannot manage this would take it on the victim. So, and again, reports show that, so not every person with a mental health issue would become an abuser, but it's most commonly seen, or I would say the high rates as perpetrators of violence against women are seen more with those having a comorbid diagnosis of alcohol substance use or single. So again, post-traumatic stress can increase the risk of being both an abuser and a survivor. You see, so and instigated to fight back. So another issue here is poor coping strategies that is seen as a challenge with in domestic violence. You see people having a predisposition to poor coping strategies are also more prone to be abusers. So again, another issue here is people with mental illness are also at a heightened risk of becoming victims of domestic violence. So this is also a challenge during this upsurge in the pandemic. So in short, violence in homes can lead to adverse health outcomes. It can lead to higher risk of chronic diseases. Domestic violence can evolve into psychiatric consequences of victimization, besides physical morbidity such as post-traumatic stress disorder, suicidality, depression, risk of risky sexual behaviors, alcohol, and substance use. So, total with what I mentioned before, confinement and lockdowns actually compel the victim to live under the same roof with the abuser. Next slide. So another challenge that we see here in this upsurge is, again, children are in greater risk of domestic violence, just as women or other individuals, women or other adults are. So you see, with the closure of schools and daycares, children spend more time with their parents. I would say children are with their parents 24/7. Elevated stress levels among parents become a major predictor of physical abuse and neglect of children who are staying at home during this pandemic. So what happens to the kids are they're more likely or they're more prone to have the parents behave in abusive or agitated ways because of the stresses that they are undergoing. So during COVID-19, and a challenge that's most eminent is the inaccessibility of many of the resources that these parents at risk or victims of domestic violence have, that they are not able to access extended family supports, cannot take their children to grandparents. There is no access to schools, daycare centers, and other support organizations. Next slide, please. So another challenge to note here is a decreased access to healthcare and community support mechanisms. I know every country has been facing it. It's been a huge challenge, whether it was to deal with the pandemic per se or domestic violence. So what we see in all the countries or globally is that pandemic has actually disrupted the usual healthcare and social services because there has been a reconfiguration of the normal health care services. So this has actually negatively impacted the reporting of domestic violence. And another challenge here is this lack of resources or access to immediate help or therapy as healthcare systems are overloaded, again, increase domestic violence or even refrain the survivor or victim from accessing healthcare. And referral rates to mental health services have reduced because of this reconfiguration, and also because there is a fear, what if there is an overload in the healthcare system, or what if there is overcrowding of women's shelters during the pandemic? There is a fear that shelters could be closed if there's a risk of infection. So again, you see that there's a lack of resources or even access to immediate help by the victims. So these factors are also coupled with the fear of accessing healthcare or seeking help due to the fears of putting oneself also at a risk of contracting COVID-19, especially like when you have face-to-face appointments. I hear that many people are hesitant to go into hospitals or even to a one-to-one therapy situation because they risk contracting the virus. So, that is also a huge challenge when it comes to being able to curb or send immediate help towards the victims. So the pandemic has also created a unique challenge for domestic violence identification and support in outpatient settings and walk-in clinics. As we all know, we have transitioned to telemedicine. We practice telemedicine, and so does several healthcare providers to maintain physical distancing. But what happens here is often when there is a phone or video conference follow-up with patients, actually it occurs in the environment where the abuser is present or the perpetrator of violence is present. So there is a hesitation from the part of the victim to divulge or disclose the abuse to legal authorities or professionals because of a fear of having more harassment, or like Dr. Sulagna mentioned, there's a lot of other cultural factors too that forms a huge challenge when it comes to diverging and abuse. So what happens is many a times healthcare providers fail to identify that the patient in front of him or her on a video conference is a victim of a domestic violence abuse. And you'll also see that so because many of the healthcare providers work remotely, like social workers also work remotely, there has been a delay or a failure in helping the victims find a proper refuge. So to just, conclude with the challenges, I would say these challenges are cumulative. One leads to another. You would see that healthcare providers and social workers, they have been working remotely or from home, so they are unable to reach victims, or vice versa. The victims are unable to reach their healthcare providers because now it's the telemedicine era. Hospitals have been closed or access to hospitals have been limited. And also, in case the victims were reached, there is a failure to find enough places or shelters. So what is happening here, the challenge is that the survivors are trapped in a spiraling cycle of tension, power, control, and
sorry, Dr. Deepa. I would like to interrupt in between. Those who all have unmuted their mic, please mute on their mic so that there is a proper audibility of the presentation. Please, all of you, if you can mute all your mics.
Yes, I have come to the end of the presentation. Thank you for the opportunity once again. I'm open to the question and answer forum.
Ma'am, we will be covering the question and answer set after all of the presentation have been covered. I would now welcome Dr. Muneeba Shakil. She is an assistant professor in psychology at Department of Humanities, CONVENOR University, Islamabad, Lahore. She will be covering the management part of COVID-19 pandemic and domestic violence.
Hi everyone. Thank you, Himanshi, for the introduction. Can you all hear me?
Yes, ma'am, you're audible.
Oh, thank you, Himanshi. Okay, this is Dr. Muneeba Shakil. I'm a practicing clinical psychologist. I belong to Lahore, Pakistan, and I'm currently working as an assistant professor at CONVENOR University, Lahore campus. So I'm really thankful to All India Association of Medical Social Work for giving me an opportunity to talk about this very important issue. Basically, by the 26th of February, 2 cases of COVID-19 were confirmed in Pakistan, and since then our government has taken some serious precautionary measures, including a strict lockdown. The lockdown was from March to June, and we were not allowed to leave our homes. Many of the support systems were not operational. Many of the hospital services were dismissed. And there was a chaos overall in public. As we know, there has been a chaos globally due to this pandemic. So by that time, due to the strict lockdown, we learned that there has been a drastic increase in the figures of domestic violence reported cases. And after learning this, I just thought of knowing about the fact and figures of domestic abuse cases. So I contacted a renowned NGO of Pakistan, just a single NGO, and they reported that within 2 months, that is March and April, 43 cases of domestic violence have been reported. Only in 2 months, and this is reported by one NGO, 43 cases, out of which 28 cases were of women and 15 cases were of children. So I wonder if we collect facts and figures from all the shelter homes and NGOs from Pakistan, from all the provinces, where the figure would end. By the end of March, after the lockdown, I started receiving calls and WhatsApp messages from women who were locked with their abusive partners and they had no way out. And they sounded so helpless and they just asked one thing: what is the solution? Where should we go? What should we do? Because all the support system was blocked. There was no support system for these vulnerable women. So I, on my own, as a practicing clinical psychologist, developed some strategies. And some of the strategies and points I have added in my presentation. Himanshi, would you please share the presentation here? Thank you, Himanshi.
Is it visible?
Yes, it's visible, and even if it's not visible, that should not be a problem for the audience, because I have jotted down the points very specifically and they're very simple. So I can just discuss it with you all. Let me open the slides here. Okay, I'll be talking about the management of domestic violence, not specifically during this COVID-19 pandemic, but I'll discuss the points with reference to management in case of other crises as well. Because there has been a lot of literature globally, and literature suggests that domestic violence do happen not only during such type of pandemics, but in other crisis situations as well. So this COVID-19 pandemic has resulted in a global restructuring of the sources of support for people experiencing domestic violence. As I have already discussed, that no support system was available and all the sources of support were blocked for these vulnerable women. And there was a strict lockdown due to this current pandemic, and due to quarantines and lockdowns, the women were stuck alone with their abusive partners for prolonged and continuous periods. 4 months is a significant duration for any abusive partner to control and abuse their wives or children. And I was continuously receiving the same complaints that they were locked along with their children and there was no way out. So I had to think and come up of the solutions and suggest them, few of them. With fewer barriers, abuse may be more frequent and of a higher severity. The stress generated from health concerns, sudden financial challenges, and the quarantine itself has been shown to increase psychological distress. There was a lot of psychological distress, not only among women who were abused, also with the perpetrators, because there was financial losses, financial challenges, and health concerns. Obviously, as I have conducted a research on death anxiety, it was prominent that youngsters were more vulnerable to death anxiety. They were suffering from anxiety issues, health issues, panic disorders, and other kinds of mental health disorders. So with this psychological distress or the negativity, this affected the mental health, well-being, and intensified the risk of domestic violence even more, where the perpetrators had the chance to control their partner and torture them even more because they knew there was no way out for them. Next slide, please, Himanshi.
Yes, ma'am.
Oh, domestic violence during crisis. It should not come as a shock or a surprise to all of us that domestic violence has been increased during this current pandemic, because I have already discussed that research around the world has shown that domestic violence do increase. Either it is a war, natural disasters, or any other conflict situations. So this is not surprising that domestic violence cases are being reported during this pandemic as well. It is well known that this has to be the case. However, during current pandemic, as a result of lockdown, many people were trapped at home with abusive partners, which worsened the situation. The case is only the worsening of the situation. This was the case. Domestic violence was prevalent. It is prevalent globally. Researches are being conducted. Measures are being taken for its management. But due to this lockdown and pandemic situation, this situation has been worsened. Next slide, please. Okay, as Dr. Deepa has already discussed the challenges, I would like to discuss few challenges to management of domestic violence. Basically, when this breakout happened, this COVID-19 breakout happened, the government did not nearsight the issue of domestic violence, and they advised people to stay at home without putting in place any resources or taking any precautionary measures to serve women for whom home is the least safe place. Obviously, it was such a panic that no one thought of the situation that would be problematic for these vulnerable women, and no precautionary measures were taken for their safety or for their well-being. So basically, APA note that before the pandemic, survivors were often able to escape, but they were able to escape violent situation. They stayed with any of their family members. They were going to shelters. They were getting restraining orders. But these all options were less feasible at the moment. During lockdown, these all options were not available to these women, which caused serious issues. Next slide, please.
Done, ma'am.
Organizations that work with the domestic violence survivors report that measures such as quarantine and physical distancing increased tension within households. Obviously, there was so much psychological distress that everyone was mentally disturbed. And very few people were able to cope up with the situation. Majority of the population, as the researchers have been conducted, were mentally disturbed. And those who were already suffering from mental disorders, they entered into a deteriorated condition. So this confinement in physical spaces, along with economic and health shocks, have increased household stress level as well. As a result, women have experienced more physical violence as well as compounded stress and mental health consequences. Like the women who contacted me for their sessions. I had no place to practice, no place to call them to give them sessions, and they were really mentally disturbed, and they were suffering from different mental health issues along with this domestic violence. Next slide, please.
Done, ma'am.
Okay, in addition to physical violence, women were being subjected to mental anguish, as I have discussed, and heightened coercion and control tactics, all of which harmed their mental health and well-being. Abusers do take advantage of stressful situations such as COVID-19 or other stressful situations to gain more control and to keep the survivors from accessing resources and support, which was the case during this pandemic as well. Next, please. Okay, I'll discuss three major actions that are being listed by the United Nations that says that governments throughout the world must take in order to end violence against women and girls during COVID-19. Not only women and girls, children are also included here. First is strengthening services for women who experience violence during COVID-19. Government did not turn ears to this issue. Globally, this issue was not highlighted in the beginning of the pandemic and lockdowns, but this appeared to be a significant issue by the end of March and April as the number of cases started increasing. So the measures that could have been taken by the government were strengthening the services, which was not done, unfortunately. The second is that they should ensure that significant data is collected to understand the impact of COVID-19 on violence against women and girls to make management plans accordingly. Globally, data has been available, but unfortunately, if I talk about Asian countries and specifically with reference to Pakistan, actual facts and figures are not available regarding the cases and the nature of cases that have been reported by these abused women. So to plan interventions and make management plans accordingly, it is necessary to have actual data, figures, and facts about the cases. Third is build capacity of key services to prevent impunity and improve quality of responses. Next slide, please, Himanshi. Okay, sorry. What should be done to prevent domestic violence during crisis situation? Because I am not talking specifically with reference to the current pandemic. I'm talking about any crisis situation. So we should develop strategies and plan management tactics accordingly. Government should support shelters for all sorts of violence, including domestic violence, shelters to help them keep providing essential services open even during the lockdown and other crisis situation. By any means, government should make sure that any of the services are not interrupted in any case, any circumstances, because these vulnerable women have no way out except the shelter homes and the NGOs where they can contact and seek help. So this is very important on part of the government to ensure the services of these support systems. Secondly, measures should be taken where the perpetrator must leave home instead of the survivor. This is very painful. I believe the one who is causing the problem should be seeking mental health services, should be taken to the shelter home, should leave the home. Why only the survivor? Why only the victim? So the person who is problematic, who is the perpetrator, should go through all these measures and bear the consequences, not the victim herself. During times of crisis, hotels can provide alternative accommodations to full capacity shelters. We all know this very well that many of the passengers that were coming from around the world were made to stay in hotels and they self-quarantined, self-isolated themselves. So this option can also be availed for women who are being abused in their homes, who are locked out with their partners. So hotels can provide a very good alternative accommodations for such women. China has adopted the hashtag anti-domestic violence during academic. Sorry for the interruption. I'm having cough, so I'm having difficulty in talking as well. China has adopted the hashtag anti-domestic violence during epidemic. And we globally can adopt the same pattern, because keeping the silence, maintaining the silence and keeping quiet is not the solution to any problem. We should always raise voice against any type of violence, whether it be against women or it be against men. So raising voice is one of the most powerful strategy that can break the confidence of the perpetrator. And keeping silence, maintaining silence can only increase the confidence. Next slide, please.
Done, ma'am.
Thank you, Himanshi. Okay, services. What should be done for these women who are locked in their homes? Government can provide ambulance or other vehicle services like motorbike services or cab services during this lockdown or in any stressful situation to these women, where they can call an ambulance or any vehicle to pick them up and take them to somewhere safe. This is a very good strategy that can be implemented even during this pandemic. Next is victims should be offered free calls, helpline and online services to provide support, especially during crisis situations. Okay, online services are already being provided. I know the services are being provided within Pakistan, the services are being provided globally, but the services are not being provided specifically with relevance to domestic violence. Generally, mental health services are provided, but I think it would be wise if these services are provided specifically with reference to these cases. And these women are handled individually. And these services should obviously be free of cost, because definitely these vulnerable women are not at all able to pay the charges. So online chat rooms. Another good option is to avail the opportunity to have a talk to professionals, social workers, or any other health experts. So through online chat room, this can be done. These chat rooms can be used to provide psychological support to the sufferers, specifically the domestic violence cases. Strategies should be planned to send codes to pharmacies, hospitals, police stations to report abuse. This is a very significant point, because at times these abused women are not able to call someone for help. And they have no opportunity to contact anyone. And, during these lockdowns, it has been very difficult to contact someone outside your residence or call someone due to the fear of contracting this disease. So if strategies are planned and codes are developed that can be sent, codes, because if you're sending a code, a specific code with a number, even the perpetrator would not be able to know what you are going to do. So if you send codes to different pharmacies, hospitals, police stations, it is very easy to report abuse. Next is online psychosocial support services should be linked to other services. Sometimes these support systems are not integrated well enough. And the victims have to go through different channels to receive support. So this synchronized system should be available, and these online services should be linked to other services provided to these women. Next slide, please.
Done, ma'am.
Thank you. Limited awareness of resources and knowledge about domestic violence have been identified as barriers for health professionals inquiring about abuse with patients. Sometimes, because of lack of awareness and knowledge, the victim herself is not able to report to the professional what is happening with her. So awareness programs and available resources, knowledge about domestic violence for everyone is very important, so that if you're able to let the professional know what is happening with you and what type of abuse is going on, the professional will be well able to help you and take you out of the situation. Next is a time when many people are more vulnerable to domestic abuse and feel trapped by their circumstances. Healthcare professionals should be hyper vigilant of signs of abuse that can affect any adult or child. A very good step was taken by Pakistani psychologists. I think each of the psychologists mentioned on Facebook gave their, or through other channels, media channels, they gave their contact numbers, their emails, for the sufferers to contact them and get free mental health services. So I think this is a very good step, and all of us mental health experts should be hyper vigilant to signs of abuse that can affect any adult or child. This can safeguard some of the most vulnerable people in society and potentially help save their lives. So it's a big responsibility on the part of mental health experts as well. Next slide, please.
Done, ma'am.
Okay, even if leaving home and going to a shelter is not what a survivor wants to do, sometimes if you talk to the female, to the woman is not ready to leave her home. She is not ready to go to a shelter. So the staff at Safe Home or any NGO program are great to talk with. They should be trained enough to talk to a sufferer, to talk to a victim, and provide them support, do their catharsis so that they calm down and feel better. So if we train them, it would be a great plan to keep self and children safe and connect to lots of valuable resources in the community. So I think we should psychologically train the staff so that they can do their able to cope with their current situation. So next, what we can do, we know that on average, domestic abuse victims experience 50% incidence of abuse. I came to know that they have experienced domestic violence at least 10 to 20 times in their life before coming to a mental health expert. So it is vitally important that all agencies are working together to reassure domestic abuse victims that they can reach out for help and support anytime. So reassurance is very important, very significant. That should be provided to them. Next slide, please.
Done, ma'am.
Okay. We can't put the burden of solving violence against women on women. Like we see that women more or often provide support to these women. We need to get men into this as well. They should talk about these issues and share the responsibility for solving this problem. It is very important that both the genders are involved in providing these services. Men can definitely talk better with men and explain them about their behaviors, what can be done, what strategies could be planned. And ultimately, we will only be able to prevent domestic abuse from occurring by challenging perpetrators' behavior. Like I already discussed, that maintaining silence is not the solution. We should challenge the perpetrator. We should give insight to him regarding his behavior. There is no excuse for abuse at any cost. Perpetrators are responsible for their abuse even in times of crisis or increased stress. This is not an explanation, not an excuse if anyone says that I was stressed out or I'm suffering from a mental health disorder or any other issue. That should not be an excuse for the perpetrator. So the focus should continue on the perpetrator, not only on the victim herself. Next, please.
Done, ma'am.
It's beneficial to make information of resources and knowledge about domestic violence available through a variety of different channels. This is very important because at times the female, the victim, does not know where to go, where to seek help from. So this information should be spread throughout the country through different channels so that the victim knows well where to go, where to contact at time of crisis. First is through community and voluntary sector networks and groups, through local radio station. This would be very significant if this information is provided to local radio station channels. And through publicizing at local bus stops, flyers can be distributed, banners can be displayed at local bus stops so that the public knows or the victim knows where to seek help from. Publishing in local newspapers, this is also very important. Asking shops and supermarkets to include posters at the front of their stores or include the National Domestic Helpline number on receipts, the bill receipts that people take home. This is also a very good step to be taken. Through posters and leaflets at food banks. Next slide, please, Himanshi.
Yes, ma'am.
Okay, it can be publicized at pharmacies, general practitioners' clinics, hospitals, sexual health clinics, and sexual assault referral centers. It can be added to public notice boards. It can be available at parks or outside council buildings, etc. There are a lot of options that can be availed to build awareness among public. So do not send any domestic abuse support leaflets directly to the household. It's being if these leaflet flyers or brochures are sent directly to the household, this would alert the perpetrator. So consult local domestic abuse charities and networks for guidance on this. If you want to help a victim, if you want to help any women or children, you should consult with domestic abuse charities or networks for your guidance. Next, please.
Yes, ma'am.
This is the last slide. Raise awareness through public awareness campaigns. Different workshops, different sessions can be conducted to raise awareness among public, and highlight which domestic abuse support services and perpetrator programs are still open and available. We should very vigilantly provide this information to the victims or to the public in general so that anyone can avail it. And lastly, set up virtual meetings to continue risk assessment and management conferences. This is very important, like we are having this webinar on this very important issue. In future, we should also have virtual meetings, continue risk assessment and conferences on these management strategies for domestic violence. So this was all from my side, and thanks once again for giving me this opportunity. And I will be available for the question answer session by the end. Thank you.
Thank you so much, ma'am, for this valuable presentation. Now I would request Dr. Mohammed Lakder, who is an associate professor in counseling and mental health at Department of Psychology, Algeria and Saudi Arabia. He will be covering role of the factors of mental health deterioration in COVID-19 pandemic.
Thanks. Good morning. If you are listen, good. Thanks. Thanks, Dr. Himanshi. It's I am happy with this scientific meeting with both Dr. Sulagna, Dr. Deepa, Dr. Muneba, Dr. Pradeep. It's I very happy which both you. It's a problem. It's COVID-19. It's a problem international. It's a view of COVID-19 intervention, psychological health and psychology, mental health. The role of some factors of mental health deterioration in the increase in the domestic violence in view of COVID-19. It's a please, sorry, it's a slide. Himanshi, it's a slide, please. Next slide. It's a problem. It's a health, mental health. It's personality structure. It's not good, neurotic or psychotic. Neurotic is psychotic. It's a problem. Family violence. it's domestic violence. Structure personality. Number one, presenting the problem. The personality structure is neurotic or psychotic that produces several factors for the deterioration of mental health and failure to adapt to the new health status of coronavirus, with its training factor for mental illnesses and appears in the form of irregularity and domestic violence. It's irregularity, domestic violence. It's a long problem, personality structure. What do you do, personality structure? It's neurotic, number one, topic one, and topic two. In the mental illnesses, good. It's no good mental illnesses. It's a factor failure to adapt, appear to its family members among family members inequality. It's a personality structure. It's neurotic or psychotic. It's a time teenager and childhood. It's declenché structure personality and neurotic stress. For example, stress. For example, anxiety. It's mental illness. Problem analysis among patients with pre-existing psychiatric illness, function with severe associated respiratory syndrome, coronavirus. It's 5 symptom coronavirus COVID-19 might extirpate the pre-existing illness and patients with schizophrenia. For example, COVID-19 medication is to treat the efficacy made by associated with psychotic. It's psychotic. It's a symptom schizophrenia, and by its COVID-19, it's a longer problem. Medication is it to treat the infection made associated with psychotic replaces, and the patients might incorporate the virus and COVID-19 and to their disease. Example, for example, it's my listen. Example, my husband trying to infect me. The domestic violence, domestic violence. It's no good personality structure personality. It's for example, medication. It's mental health no good. Schizophrenia, for example. It's my husband trying to infect me. It's very risk. It's very risk on family. Domestic violence. It's for example my husband trying to infect me. In addition, psychotic and psychotic symptoms, irrational, for example, thinking. Dr. Muneeba, it's after the time, it's beliefs. It's irrational thinking. It's cognition, no good. Poor insight and social status lead to domestic violence. It's domestic violence experience the male, it's 15% to 17% increases. It's a symptom and disorders leading to domestic violence. For example, aggression. It's aggression. It's a personal restriction. No good. It's a health, mental. It's a no good aggression. It's altered conscience, anxiety. It's attention. It's adultery, hallucinations, compulsion, depression, for example, depressive mode, insomnia, irritability, memory impairment. It's 10 to it's 9 to 10. It's it's a behavior disorder. Number 1, it's aggression. It's for example, number 2, anxiety. For example, number 8, insomnia. For example, number 10, memory impairment. It's factor 10 factor. It's deterioration to the disorder, domestic violence. It's aggression, for example, it's stricter personality, confusion, depression, black, for example. It's for example, read in studies of previous coronavirus, non-COVID-19 epidemics suggest that COVID-19 is likely to be associated with a wide variety of psychiatric symptoms and disorder leading to domestic violence. It's a 10 factor symptom and disorder leading to domestic, for example, aggression, it's depression, it's memory impairment. It's 2 factors declenching. It's domestic violence. Domestic violence. It's a grand problem. It's and the family. It's a school. It's
Dr.
a society. It's a no.
Dr. Roubi, there is an announcement. Can you please hold a second? There is an announcement.
Yes.
Sir, please. Dr. Pradeep, please.
Hello. Our associations will share a link on 540. This is a feedback link. The people who fill the feedback form, the certificate will be provided only to those people. So please fill the feedback. Thank you. Dr. Roubi, please.
It's problem, Dr. Bardi.
No, it's okay. No problem. We continue. No problem, sir. We continue.
Why not?
Please, Dr. Roubi, please. Dr. Roubi, please. Please, we continue.
Yes, I continue.
Yes, continue.
Thanks a lot, Dr. Bardi. It's the domestic violence. It's grand problems. It's grand problems and family and it's a school and society. It's no safety. It's no safety. Côté psychology. No safety school. No safety home. It's family. It's a risk. It's a risk. Symptom, health, mental disorder leading to the domestic violence. It's the proposal. It's opens its problems. Domestic violence. It's number one activation of differentiation diagnostic between symptoms associated with coronavirus and symptom of mental health diseases. It's a proposal. It's a society. It's family. It's a school activation of the differential diagnostic. It's for example, differential diagnostic. It's depression, aggregation. It's personality restriction. It's important. It's three important differential diagnostic between symptoms. It's on for example some medical. It's for example on health, mental, on school, in hospital. It's a very important differential diagnostic between symptoms associated with coronavirus and symptom of mental health. It's a symptom coronavirus and symptom mental health. It's now le même chose. Now it's definition exactly. It's diagnosis exactly. Diagnosis exactly. It's we have differential diagnostic between symptom coronavirus and symptoms of mental health. Number two, proposal number two, activation the role of home medicine in crisis. It's the très important. It's activation the role of home medicine in crisis. It's domestic violence. It's domestic violence. It's and coronavirus. It's crisis. It's what do you do? It's activating the role of home medicine. See, it's très important. It's medicine home. The proposal number three, activated online home and the family counseling. C'est très important. It's online and the coronavirus, online home and the family counseling. Counseling, for example, family counseling, childhood, counseling teenager, counseling children, total. It's activated online home and family counseling. It's a number four, activation the role of positive psychology. It's the très important. It's important. It's positive psychology. It's for example thinking positive. It's personality positive. It's society positive. It's school positive. It's program school. It's positive. For example, contingent program school. It's positive. The treatment of domestic violence, problem. It's activation, the problem, the role of positive psychology in, for example, school curricula to develop planning behavior within society. For example, it's important. It's psychology positive. It's psychology positive. It's sister. It's son. It's a child in school. home, it's in family. It's thinking, it's thinking positive. It's a proposal number 5, opening centers to support domestic violence. It's opening centers on in crisis health, for example. It's opening centers. It's counseling, for example, family. Opening centers. Counseling health mental. It's opening centers counseling and positive psychology in school, for example, to treatment. It's a therapy. Domestic violence is therapy. Domestic violence in opening centers, and it's a national or international. It's times of health crisis, caring for children affected by domestic violence. Domestic violence affects children. Aggregation, male and female. It's aggregation father. It's a brother. It's affect what? It's affect children. Or the proposal agreeing for children affected by the domestic violence, and the treatment and the therapy, psychology, positive and health, mental, and counseling. Number seven. It's finished proposal. It's creation of a diagnostic guide. C'est très important. It's a diagnostic guide. Diagnostic guide très important. It's a guide diagnostic for domestic violence. For example, a guide, the diagnostic domestic violence in India, in the Pakistan, in Algeria, in Saudi Arabia, and it's groups, psychologists. It's creation of diagnostic guide for domestic violence. It's very important. It's creation of diagnostic guide, for example, in India, in the version India, version Pakistan, version Canada, version Paris, French, etc. It's happy. It's thank you so much with the scientific meeting with both Dr. Sulagna, Dr. Deepa, Dr. Munib, Dr. Pradeep, Dr. Himanshi. It's thank you so much. Thank you very much.
Thank you so much, sir, for your valuable comments. I would request you all to kindly sorry. If anybody have any queries or questions, they may please
Himanshi,
ask.
there are many questions in chat box. Please go to chat box and ask to the presenter.
I will be taking few questions only due to the time constraints. One of our participants has asked that sometimes victims do not consent for legal action because of fear that situation would be worse in long run, and they have asked for solutions. They have asked to suggest solutions regarding that.
Himanshi, it's not clear for whom this question is. I think I should answer this.
Yes,
No,
ma'am,
sure.
please.
Okay, basically, yes, it's true. They are so fearful that something worse can come out of it if they take any action, and they're not ready to give their consent. Even if they are motivated, they're made to understand that it is necessary for their own good. So I think this should be done on part of the government. They should generate, the government should generate such resources, provide such services to these women so that they're not fearful for their future. Because in the long run, when the support system is done, when the NGO is done, when the shelter home is done, the women are on their own. So I think important opportunities should be provided, work opportunities should be provided by the government to these women so that they can support themselves, their children, their families.
Run. So it's understanding what the victim actually wants, what the victim's direction is. It's sort of an all or none phenomenon. Does the victim want to continue the relationship with the perpetrator? That's why she's fearful that raising her concerns might mean that the abuse would worsen. Or is it coming out of that relationship and being in a favorable position to raise her children on her own? Whatever be this, way forward, I think it bottles down to women empowerment and building up their confidence and being able to economically sustain themselves. Once that sustainability sinks in, alongside what Dr. Muneba and Dr. Deepa has already mentioned during that talk, with government support, with social work support, with support of charities or NGOs, she will be able to thrive. But if the woman, the victim, is underconfident and has poor self-esteem, poor self-confidence, he or she will not be able to thrive, whatever support is put in place. So I think the starting point is understanding what the victim actually wants. And thereafter, it kind of builds on layers of women empowerment or victim empowerment, and so that the ability to thrive on their own and being able to raise their own children. Thank you. That's what I wanted to say.
Shall I proceed with the next question? Okay. So many of the participants have asked that, is there any law to stop the violence caused by women in family?
If I may answer, with reference to Pakistan, there is no such law, because I know one incident where a client of mine, a male client of mine, was being beaten by his wife. So he went to the police and filed his complaint, but the police made fun of him and told him that there is no such law in Pakistan with reference to domestic violence against men. The case can only be filed if the victim is a woman. So I don't know whether there's any law with reference to India or globally. I'm not aware of it, but with reference to Pakistan, there is no such law. They don't think, it's a stereotype. They don't think that men can be victims of violence. If Dr. Sulagna or Dr. Deepa have to add something to it.
I'm in the same page as you. I'm not familiar of any law worldwide that is against women so far. It's kind of going by the statistics, it's 1 in 3, 1 in 4 we are dealing with as against 1 in 10 for men. But I think, there would be something if it came to criminal charge or criminal damage, but I'm not sure if there is any law at the moment.
Is the question seeker satisfied with the answer? Or shall I proceed? A participant had asked that she would like to know if the survivor feels that if some factors would be removed, like in-laws, the partner would not attack the survivor. Any suggestion? Open question to all of the panelists, and any one of you can answer.
Deepa, sorry, but can you come again with the question? The signal was break. I could not hear you.
Ma'am, Ms. Kriti would like to know if the survivor feels that in some factors would be removed, like in-laws per se, the partner would not attack the survivor. Any suggestion? I think her indication is towards the female partner, and yes, she wanted your suggestion.
What can be done? I think this is totally on part of the victim or your client, because psychologists are not supposed to intrude into such matters, and we psychologists never give direct suggestions to the clients. Even if the client says that she wants to with a nuclear family system, she wants to join a nuclear family system and leave the joint family system, we cannot say that, yes, you can do it, or we are going to help you, or give her any suggestions. We can just guide the victim with what the advantages would be of moving out of the joint family, or what the circumstances would be. Then it is definitely on part of the victim to decide what she has to do. Because in the long run, we are not going to be there. It will be the victim who will be bearing all the consequences and facing everything. So we just do the cost-benefit analysis and give a direction to the client. But the decision is always the client's. It's not about the clinical psychologist or any health expert. I hope I have answered the question. Is it satisfactory, or I have to add something else?
Ma'am, I think she got your suggestion. And as we are running short of time, I will be taking one more question. It is from Ms. Shilpa, and she has been asking, do the Western countries have mental health protocol in their disaster management guide? If yes, what all are the components? Dr. Deepa, please unmute yourself.
So I'll take this question. It's a very good question, very pertinent. The American Psychiatric Association have advocated that any victim of intimate partner violence be evaluated when they come for help, whether it be to healthcare or social services, as part of best practice, best clinical practice. So this includes anyone coming with mental health symptoms or disorders like depression, anxiety, post-traumatic stress, or even with injuries, So it's very normal if you come to the OPDs in our healthcare system here to have questions asked you whether you have sustained, if you had a fractured foot or a fractured wrist. It's very common to have questions asked to you whether it was part or it was due to domestic violence or intimate partner violence. So, and what includes in the assessments and evaluations are safety assessments to evaluate if the victim or the patient who has approached you is in imminent danger or in immediate danger, and to evaluate whether there's any danger that could be removed. So safety assessment is is a very pertinent component as part of the management. Second part is suicide assessment. Is the victim prone to harm herself or himself, or are there any planned are there any suicidal plans in place? So these are two important assessments. Then we have danger assessments, like we have the clinicians assess what's the level of danger the victim is in, so that that can be removed or interfered with. So very important here is the Canadian Code of Ethics for psychologists here in the Canadian Code of Ethics and the American Psychological Code of Ethics do ask us, as part of our informed consent process, that we tell our patients that if they divulge to us regarding domestic violence, we are mandated to report it to authorities so that we are certain, or we see that their lives are safe. So once the evaluations are done, healthcare providers would do the necessary referrals to, it could be to a community nurse or a social service organization, or to psychologists. And also when referrals are done to psychologists, it would be in light of the psychological treatments for PTSD, anxiety, and also when they come to the history of former history or past history of substance abuse and domestic violence. So these are the protocols that we, I would say in short, that we follow through when we have it doesn't have to be a victim necessarily, but for us, it's, we ask questions. Like as I said, if it's just injury or anxiety or depression, we do ask questions. It may not be pertinent to them, but we do ask questions. Has there been domestic violence in the family, or has been there domestic violence in the household, so that we can, avoid or thwart any violence or imminent violence. Have I answered the question?
I think the same applies here in UK, that as part of any assessment process, that these are routine questions you have to ask. These are areas you have to probe, without which an assessment is not complete. taking a good social history, getting a good past history, blending in with the social history, the family structure and the relationships, and thereafter moving on to the risk assessment, which, you know, Deepa mentioned about the suicidal tendency, which can be, you know, generating from violence. So this is part of the routine assessment protocol that is blended in, and you know, it's part of you know, that guides our management plan. Thank you.
Mosi, go ahead. Himanshi, are you there? Pradeep sir, are you there? Pradeep sir?
Hello. Hello.
Sir, sir, go ahead.
Okay. So first of all, thank you so much to all my speakers for delivered of what a great and wonderful lectures. So first of all, I'm grateful to Dr. Sulagna, who delivered lectures on an issue having to COVID-19 and domestic violence. So really, her session was fruitful and meaningful.
Your voice is not coming. You are not audible, sir. Please. I think Pradeep sir is lost his connection.
I can see him. He has to unmute his microphone.
Okay. Pradeep sir, please unmute.